Good afternoon, and thank you for joining us. My name is Tina Tebow, and I will be your moderator for this afternoon's news conference. Joining us today, the Honourable Stephen McNeil, Premier of the Province of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Go ahead, Premier.
Thank you, Tina, and welcome and good afternoon, everyone. Dr. Strang and I are excited to be back to see you. This has been a long weekend and a difficult weekend on Nova Scotia when it comes to the number of cases of COVID-19, and Dr. Strang will give you an update.
Thank you, Premier. Today we're announcing 26 new cases of COVID-19, bringing the total number of confirmed cases in Nova Scotia to 262. There are currently 6 individuals in hospital, and I'm pleased to tell you that 52 people have now recovered and their cases of COVID-19 can be considered resolved. Overall, most of our cases have been connected to travel or a known case, but we now know that this disease is in our communities. That's why we're adjusting our testing strategy. We want to have more options to identify and test for COVID-19 in communities. We need to be flexible and be able to react quickly to the path this disease may take in any community in Nova Scotia. To that end, we're working with our partners in the Nova Scotia Health Authority, both Public Health and the Microbiology Lab, as well as 811 and EHS to offer more testing options. When we identify communities where our surveillance suggests increased disease activity, we may stand up temporary assessment centers if there isn't a center in close proximity. Today, we opened the first of these centers in Elmsdale. We're aware of increased disease activity in the East Hants corridor, Elmsdale and Enfield, and so we're moving in there starting today with enhanced testing. These centers, it's important the public to know, these centers are not for walk-in. They will operate the same as other assessment centers do now. People must be referred for testing via 811 or a primary care physician and receive a scheduled appointment. How long these temporary assessment centers will stay open in any one community will depend on the disease activity that we pick up and the needs of the community. In communities where there isn't an appropriate facility that could be used as a temporary assessment center, NSHA is also working to establish a mobile assessment unit. This would be a portable unit in a large truck that could be brought into communities temporarily to do screening and testing. EHS also has 2 mobile units in two SUVs staffed by paramedics who have been trained to do at-home testing. These will be used in situations where there are people who have mobility issues and cannot get to an assessment center, or in situations where there's a group of people where testing needs to be done, for instance, in a long-term care facility. There'll be each of these mobile units, there'll be one in HRM and one in CBRM, and a decision on the use of these units and where to deploy them will be made in discussion between Public Health, 811, and EHS on a situation-by-situation basis. I'm also very happy to report that as of tomorrow, the lab will be operating 24/7. This will allow them to process well over 1,000 tests a day if necessary. I want to take a moment to thank everybody involved in developing and standing up these testing options. A lot of people have worked long hours very quickly to work through all the details of how all these different testing options will work. And it's a testament to our ability to work as a single health system that all these various parts of our system have come together with a sense of urgency and working extremely collaboratively. So I want to thank everybody involved for those. I also want to talk to employers today. As we get more cases, workplaces all over the province are being impacted. From what I'm hearing and from my medical officer of health colleagues, that employers are taking this very seriously and following public health advice. But I want to take a moment just to clarify how public health follow-up works and how workplaces will or will not be involved as necessary. When someone tests positive, all of their close contacts are notified by public health. If a workplace is involved, public health will work with the employer and the employees to identify and manage people who would meet criteria to be considered to be close contacts, as well as giving advice on any special measures such as cleaning that's necessary for the workplace. If a workplace isn't notified, even though one of their employees may have been identified as a case or a close contact somewhere else in the community, that means there's no exposure in the workplace and employees can continue to go to work as usual and normal. We are seeing some circumstances where a workplace goes frankly into chaos and shuts down simply because one of their employees has been even suspected and is of COVID and going in for testing. If a workplace is impacted, employers and employees will hear from local public health, and public health will give appropriate and necessary guidance. It would be a rare circumstance for public health to advise shutting a business down completely. I recognize that some employers may feel more comfortable making that decision. That is your choice. But as we've said many times, it's also important that businesses who can stay open do. Last week, we launched a new tool for employers and businesses who have questions about whether or not they can remain open and what they need to do to stay open under the orders under the Health Protection Act. That website's been widely used. In the first week, it had almost 10,000 visits. If you're an employer and have questions, that website is a great place to start. It's on our coronavirus website, novascotia.ca/coronavirus. And look in the section Supports for Nova Scotians, Individuals and Businesses. I'd like to close by saying that coronavirus is here in Nova Scotia. It is in our communities. Expanding our testing options means we have the ability to act quickly if we see clusters of disease in communities or locations or settings, and that ensures we are able to accommodate vulnerable Nova Scotians and those living in hard-to-reach communities. But testing is only half the battle. We can't be fooled that simply knowing how many people have the virus and getting them to self-isolate will completely slow this virus down. We have to continue with the public health measures, keeping physical distance, only gathering in groups of more than 5 if absolutely necessary. You've heard the Premier on Friday, stay the blazes home, and that's really important. And I want to unpackage that a little bit because I'm hearing, even this weekend, of a number of situations that people, even though most Nova Scotians are getting it, some Nova Scotians are not getting it. The first is about shopping. It's important that people do essential shopping only. Now's the time to do online shopping as much as you can. And if you do, and it's essential shopping is gas, groceries, going to the pharmacy. Please plan ahead. This is not the time to say, oh, I need 4 things at the grocery store and I'm just going to pop down. Make a plan. You should not go shopping more than once a week. Some people are even doing it twice a week. Work together as communities. I know my household, my wife is working as a group of 7 homes that are sharing the load for shopping. So one of them has taken the job and says, I go to Costco every week or every 2 weeks. And by email, they say, who else needs some things from Costco? So one person shopping is actually shopping at one location for 7 households. Think about how you can support each other and be creative to minimize the number of people going in and out of stores. I'm also hearing a lot about people, questions come to me, can I just drive for socializing? Now is not the time to be going out and about our communities unless it's necessary. Like the Premier has said, walk for exercise, not to socialize. Please, now is not the time to drive just to socialize. You may think that it's okay just getting in your car and driving about, but the fewer people we have on the roads means fewer trips to gas stations. It also means that there's a less chance of an accident, and we have to have our healthcare system, which is stressed right now, deal with people that may be injured in a motor vehicle crash. Along with that, we're still here, lots and lots of people are using online, I'll call it flea marketing, Kijiji and Facebook online market. It doesn't make sense if we're saying to people, stay at home only and only go out if it's essential shopping. Now is not the time. I know lots of people are using the time at home to do spring cleaning and put things online, but now is not the time to drive around. Even if you say, I'm going to pay you electronically and pick it up at the top of your driveway, people's hands have been on those things that you're picking up. You're still going out doing non-essential driving. We need to be able to stay at home as much as we can, only go out and about beyond just walking in our communities if necessary. The last piece, as the weather gets nicer, we have more and more people that may be thinking about either they can start to go to their cottage if their cottage is a year-round cottage, or starting to go and open up their cottage. Again, now is not the time to do unnecessary driving and trips. You may think that you're going from one home to another and you're taking your groceries with you. And yes, any one family, that's a low risk. But if we put that all together and have more and more people driving around, having to stop for gas, all those things, the more movement of people we have around Nova Scotia, it creates a substantive increased risk for all of us. So what may be a low risk for one family can lead to a large risk for all Nova Scotians if lots of people are doing it. So if you have a cottage and it's year-round, choose one place or the other. Go there and stay there. Make that your home. Don't go back and forth between multiple residences. You're going to have to leave your cottage. If it's not open yet, you're going to have to wait. Hopefully we'll start to get out of this by in May into June. You're going to have to wait till then to go out to your cottage. Please choose a home. Stay as close to home as much as possible. I was telling the Premier, I was reading a paper in the last few days that based on some modeling that showed that it needs at least 80% of the population to strictly stick with public health measures for those measures to actually have the impact that we need to have to decrease transmission of the disease. And if you have more than 80%, you get better, stronger and stronger effects. But all it takes is a slip down to 70% of the population adhering to public health measures and 30% not, and you have no effect at all of the public health measures. The message is that all Nova Scotians, every single Nova Scotian needs to do their part. It doesn't take very many of us to not doing what we need to do, and then that hard work that everybody else is doing and the pain and sacrifice that everybody's doing is for naught. So please, every Nova Scotian, do your part. Don't think about yourself. Think about your community. Look after one another, but put everybody else in your community first ahead of yourself.
Thank you, Dr. Strang. That paper identifies that we are all in this together, and the only way out of it is if we all do our part and follow the rules. Tina.
So we'll take questions now from reporters on the line. Again, we'll take questions in the allotted time that we have. We'll start with Alexa McLean from Global. Go ahead, Alexa.
Good afternoon. I'm wondering what technology is used to determine which regions require these temporary assessment centers, and how can the general public use this information to help lessen the burden on public health and slow community spread?
So we're looking at that. We know the location. We take the location of where testing is happening, and from our assessment centers, as well as we follow up contacts, and we look at that from a local geography level. We need to think about carefully about how we make that public. We have to be careful about disclosing health information on any individual. We also have to be careful about stigmatizing and labeling communities. So if we say this community acts, has an increased risk, that can potentially draw some negative attention to that community. But I'm also concerned that by focusing on one community versus another very strongly in a public way, that we actually gives a false sense of a false sense of reassurance for other Nova Scotian communities. Nova Scotians need to understand that everybody is at risk. We all need to play our part, and that there's the potential for COVID-19 in every community. If we identify communities where enhanced testing is happening, that community will be made aware. It's well known now in Enfield, Elmsdale today, because there's been communication in that community as the assessment center has been established. But I have a lot of reservations about putting too much information out there without the right context that can actually send the wrong message around stigmatizing communities or giving Nova Scotians a false sense of reassurance.
Go ahead, Alexa, if you have a follow-up question.
Yes, Tina, thank you. I heard today from the IWK that there was COVID-19 exposure there. Several staff are now directed to self-isolate. I'm wondering, what strategy is in place to manage healthcare staff shortages when more frontline people get exposed to the virus and ultimately have to self-isolate?
So both our health authority as well as EHS, the continuing care sector, have been supported by public health, giving them good public health advice for their occupational health issues around how to manage people or healthcare workers who are exposed or if they're a case. There's no doubt that one of the challenges that COVID-19 is and will present to our healthcare system is how do we maintain essential healthcare services when there are healthcare workers who are going to need to be off work, whether they've been infected or whether they're a contact that can't come to work. There are strategies that, if absolutely necessary, that healthcare workers who have been identified as contacts could come to work with certain strict precautions in place. Those are steps of last resort, but we have those identified if necessary. But again, this is all about how do we protect healthcare workers? Well, if we all do what we've been told and asked to do, it minimizes the chance for healthcare workers to be exposed in their community. And then, because we need healthcare workers to go to work, if they're exposed in their community, then there's possible they're going to bring that into the workplace. So let's help our healthcare workers out, so we can all receive the health care that we need by minimizing the chance of them being exposed in their community, and frankly, minimizing the chance of them being exposed when they put themselves at risk by being willing to look after us if any of us are sick with COVID-19 or any other healthcare need.
Next, we'll go to CTV's Nick Moore. Go ahead, Nick.
All right, thank you. This question for Dr. Strang. Families say they're receiving letters, family of people who have family in long care homes, are saying they're receiving letters saying that in the event of an outbreak there, it's better for the care of patients to take place in the long-term care home rather than the patient being transported to hospital. Can you clarify what, if any, direction long care homes are getting in Nova Scotia if and in the event of an outbreak?
So we've certainly working, I agree with that. It's absolutely one of the things we're trying to do is minimize the flow of people across the health system. So we've been trying to get people who are looking for a long-term care bed out of hospital as much as we can, and we've made them a priority to get them into long-term care facilities. And we're supporting long-term care facilities with plans that if they have a resident who becomes sick, as much as we can, how do we actually keep them in that facility? So we're not taking them, transferring them, exposing more healthcare workers during the transfer, and potentially bringing COVID-19 into a hospital. If somebody absolutely is critically ill and needs the support of an acute care hospital, they will get that. One of the things we're also, however, encouraging, and I think this is an important but difficult message for families to hear, if your relative or a parent is in a long-term care facility, does not have an advanced care directive, so very clear instructions about what the family and that individual wants to have done if that person is critically ill, and many families have these in place, and they really say this is the level of intervention we want to have, and we don't want to go beyond that. That needs to be clearly spelled out. Now is the time for all families with a relative in a long-term care facility to make sure that they have that conversation with their relative, or if the relative is not competent to do that, who's legally designated to make those decisions, have an advanced care directive in place. Because quite frankly, that will help. If there's no advanced care directive, the healthcare system has no option but to give the highest level of care possible. That may often be not what the family wants. But it's important that you have those advanced care directives in place to help residents get the appropriate and what's level of care and the level of care they wish for, and not go beyond that.
Go ahead, Nick, if you have a follow-up question.
Thank you, Dr. Strang. And my second question would be for Premier McNeil. It's been another weekend, and we have another weekend of people being ticketed for not staying in their homes. I'm just wondering if this changes anything in your mind about how to go forward in terms of trying to enforce that policy.
Well, we're going to continue to remind Nova Scotians that in order for us to find our way out of this pandemic, it will require all of us to stay home. We have seen people continue to ignore that order. I was pleased to hear, but surprised, law enforcement had to issue the number of tickets they were issuing this weekend, and if required, we'll step up enforcement. This is something that will require all of us to do our part, and for those reckless and selfish few who aren't, we'll continue to have law enforcement to force you to do your part.
Next, we'll go to Shayna Luck from CBC. Go ahead, Shayna.
Good afternoon. First question to Dr. Strang. Just regarding, we're hearing about number of exposures of healthcare workers, Shannex locations, the Aberdeen Hospital, the IWK, and you also mentioned, of course, the new mobile testing by EHS. So given all of that, I'm wondering if you could explain what, if any, precautions are being taken to keep staff who treat COVID patients separate from the rest of the healthcare system.
So we're working with, and certainly in our continuing care sector, as much as possible. What we're putting in place is that as much as possible, staff don't work in multiple facilities or with multiple organizations. That can present some challenges staffing-wise. But we're trying to minimize the number of facilities that one individual would work in. We're also working with facilities that if a healthcare worker if a resident or residents become ill, that then they get cohorted and separated from the rest of the residents, and part of that would then be having a specific group of workers, if possible, who only work with those ill residents, and they're not going between ill and well residents and minimize the chance of them spreading the disease. The same thing in our acute care hospitals. People are much are well aware of the need for them to closely monitor their symptoms, to not come to work if they're feeling unwell in any way. We've increased the capacity in occupational health. NSHA now has a 1-800 line for workers that are, it's not just NSHA, but anybody who NSHA, IWK, long-term care facilities, EHS, if they have concerns and they feel they're unwell, and then they can call that line and get direction, and they can get directed in for testing as necessary. So a lot of steps are in place to try to minimize the chance of healthcare workers bringing COVID into healthcare facilities. We also have very robust, strong infection control guidance, both for acute care and continuing care, that provides the necessary protection for healthcare workers while they're caring for residents or patients to minimize the chance of them getting infected.
Go ahead, Shayna, if you have a follow-up.
Thank you. Yes, for the Premier. Premier, we're hearing from police, Halifax police, that they issued dozens of tickets this weekend. We know they have wide powers to ticket, even arrest people. So I'm wondering, what commitment will you make to ensure this doesn't disproportionately affect people who are Black, Indigenous, homeless, mentally ill, new immigrants, otherwise marginalized? I'm just wondering what commitment you can make there.
Well, the virus doesn't discriminate. The virus is after all of us. Quite frankly, we have to assume all of us are carrying the virus. Regardless of which community you come from, how long you've been here, is irrelevant. The reality is each of us have to stay home. And law enforcement has a responsibility for those who choose not to enforce the law. And we expect them to enforce the law regardless of who it is who is on the streets ignoring the public health order.
Next, we'll go to Devin Stevens from all Nova Scotia. Go ahead, Devin.
Hi, Premier. I'm just wondering if you have any clarity on when people will be able to apply for the programs you announced last week. Are we looking at Monday or Tuesday? And also wondering, as strange as it is to think about it, Friday is a holiday, and I'm just wondering if that's going to impact the province's ability to get those checks out this week as planned.
It should be up on our website tomorrow. We'll start that processing this week. They'll continue right through the weekend processing applications. We'll continue to get them out as quickly as possible. It's our hope that, particularly those that will be direct deposit, they'll see those towards the end of next week. But you raise a very important issue, which is we are coming up to a long weekend, one that'll be 4 days, and we've seen what's happened in the last number of weekends. It will become all that more critical that Nova Scotians follow the public health order and stay at home and isolate themselves. This is the time of year, or this coming weekend will be the time of year. For many, it is a time when there used to be lots of gatherings, whether it be in the Christian faith or, quite frankly, in our own families. This will be a year where all of us are going to have to find out a new way to do our own worshiping and, quite frankly, our own way to stay connected to our families over this weekend. Otherwise, this pandemic will not be leaving Nova Scotia anytime soon. It will require all of us, regardless of how long the weekend is or when there's a holiday coming, to continue to follow public health rules.
Go ahead, Devin, with your follow-up.
Yeah, and I was just wondering, too, on the $5 million that Dalhousie has left to spend from that fund. Do you have any timeline on when that's going to happen? Because, as you know, every day is important to small business. So are we looking at, 2 or 3 weeks by the end of the month, or is it more open-ended than that?
No, we continue to look at issues that come up. We also have the ability to repopulate that fund, depending on the length of time of the pandemic and how long we have to continue the lockdown. We continue to repopulate that. As you know, one of the commitments that we made, the Emergency Workers Fund, is for those who are self-employed or who don't qualify for employment insurance. The federal government is committed again today to having money in bank accounts this week. This is to help those Nova Scotians that wouldn't qualify for those for another month, to help them through this period of time. And then we're trying to put money in the pockets of small businesses in our province, up to $5,000, depending on what your receipts were for last April. But we're going to continue to work with them, and we'll continue to monitor it. And if we see other issues that we have to address with that, we'll use that remaining money or money that we add to the pot.
Next, we'll go to Paul Wildinat from Radio-Canada.
Yes, thank you very much. So I have a question for Dr. Strang. I just want to know that how concerned are you at this point, because we are announcing more cases in nursing home. Yesterday, there was a Shanex who said that employees in Halifax and Durham location contracted COVID-19. So how are you concerned for residents in nursing homes right now?
So I'm very concerned, as all my public health colleagues and clinical colleagues across the country are. This is a very serious disease in the elderly, especially the frail elderly, who are the majority of people in our long-term care facilities. You just have to look around Canada and across the world to see what impact this could have. We are taking the steps that we can take to protect residents as best we can. But we have to have people from communities going in and providing care. So it is concerning, but frankly, I come back to my messages earlier. It's incumbent on all of us to we can enhance testing and be looking for cases more, and we're doing that. But that's only half of the picture. The other half is what all of us have to do together. How do we protect our seniors, our most vulnerable in our communities, in our long-term care facilities? We protect them by minimizing the spread in our communities, by minimizing a chance that the healthcare worker who will still go to work willingly to look after those residents doesn't unnecessarily or unknowingly take that virus into a long-term care facility. All of us, every single Nova Scotian, has to work together to protect each other and especially protect those who are most vulnerable for getting severely ill and dying from this disease. It's a call for all of us to do what's necessary.
Go ahead if you have a follow-up.
I'm good. Thank you very much.
Great. Next, we'll go to Ken Kingston from News 98.9 XFM in Antigonish. Go ahead, Ken.
Thanks very much. This is a question for Dr. Strang, please. This weekend, the Aberdeen Hospital in Glasgow announced that their Women and Children's Unit would be shut down for the time being, and then it came out on the media that an employee of the hospital had tested positive for COVID-19. Just wondering, is there any additional measures that are being implemented at that hospital right now?
So I'm not aware of all the details. I'm aware of that case. I do know that they've adjusted staffing levels and shift some services temporarily to other hospitals. As I said, every facility, the Nova Scotia Health Authority has a robust team of both infection control experts and occupational health folks, which will give the necessary guidance for healthcare workers, as well as we have, the guidance for the dedicated cleaning staff who are in there taking the necessary steps to keep our healthcare facilities as safe as possible.
Go ahead if you have a follow-up, Ken.
No, I don't. Thanks very much.
Great. Next, we'll go to Tim Bousquet from the Halifax Examiner.
Hi, thank you. Dr. Strang, as I counted, there were 55 new positive cases over the weekend. Can you tell us, were any of those related to long-term care facilities? And do you have an update on what the status is at long-term care facilities and also the Westville funeral and the hockey tournament up there?
So, as you can appreciate, with 55 new cases over the weekend, public health is working really hard to investigate all those. Many of them are still under investigation. I have not been made aware of any specific cases linked to that funeral that we've talked about earlier. There may be, but none that have come to my attention. We certainly do have more healthcare workers both in home care and the long-term care facilities that have been identified as part of these new cases. Again, I don't have specific details on any individual case. What I want people to understand is that local public health investigates all of these cases. When it involves either a home care agency or a long-term care facility, they work very closely. There is now I'll call it a table that's set up that brings together representatives in the continuing care sector with folks from the health authority as well as the health and wellness, who are the leads in continuing care. That group is working very closely with public health to manage, and so public health does the management of cases and contacts, works very closely through that continuing care table to manage all the other issues around staffing, etc., giving advice to the whole continuing care sector. I sit at a level, I don't get the details of every single case, but I make sure that I have oversight and make sure I'm comfortable with all the measures that are in place and the right people are working together to make sure the right things happen.
Go ahead, Tim, with your follow-up.
Yes, Premier McNeil, the Nova Scotia Federation of Agriculture is saying that there's a movement afoot to establish an isolation facility for temporary foreign workers on April 14th. Do you have information about that and where that would be, how many people would be isolated, and who's funding it?
No, I don't. I do know that the Prime Minister said as recently as this morning that temporary foreign workers that would be, which are an important part of the delivery of food across our country, would be coming into Canada at some point, but they would have to follow all the public health rules of 14 days of self-isolation and all of that. So that would be happening at the national level. My recommendation in the conversation would be that if they're going to isolate, they need to do it at their final destination, because I can clearly tell you that if someone comes into Canada and is isolated in another Canadian province, when they enter into Nova Scotia, they will have to self-isolate here again. So this is not one of those things where they can self-isolate them in another part of Canada and then put them on a plane to get them here. We will fully expect them to follow the public health protocols.
Thanks, Tim. Next, we'll go to Bill Martin from Six Rivers News and Radio. Go ahead, Bill.
Thank you. For Dr. Strang, on Wednesday evening this past week, the Director of Emergency Measures for Cumberland County reported to Municipal Council that he had used an interactive world map that allowed people to drill down by country, by province, and even by county. And he reported to Council there were between 2 and 20 actual cases in Cumberland County. Would you regard that as reliable information?
So I'm not sure it's reliable or not, because we don't look at cases by county level, where what we're reporting publicly every day is updated by Nova Scotia Health Authority health zones. We have 4 of those. When we're looking at internally in public health, looking at our data, we look at it at a much finer level than just by county level. So I don't know if that's accurate or not, and I'm not sure where that map would frankly get its information from, because we don't share. We're not sharing information other than to the federal government, which is all guided by confidentiality. We're not sharing any of our data in any public way.
Go ahead, Bill, if you have a follow-up.
Thank you. The response to his report, given that he's the director of EMO, was really quite astounding. People were looking for that kind of information and surprised that he appeared to have it. Since then, you publish a daily update on the cases map, but unfortunately your data is based on how many positive tests were deposited within one of the 4 regional zones of the NSHA. It doesn't actually tell us whether a resident still lives there is now infected. It's clear that people want to know how many residents by county are near them, and the current map you're offering is too vague to provide that.
So I come back to my comments earlier that we can look at that, and I'll take this back, but I have some reservations about that we got to respect, especially when we in some communities there may be very small numbers, that we are actually disclosing somebody's personal health information by drilling down too fine, even by county level. It also, I come back to that, to me, in some ways it's a distraction, with all due respect, people wanting to know what's in their community. But we need Nova Scotians to understand and to act like this is in their community, whether it really is or not, because it's likely to be there sooner or later. We need everybody to take the necessary steps to prevent spread in communities. And I'm very concerned that giving out that level of information actually gives people a false sense of confidence that, well, it's not in my community, so I don't have to worry so much. But there's also a concern about stigmatizing certain communities, especially when we have communities. Some of our communities are based on ethnic and cultural backgrounds that I think we have to be very careful we don't do damage to those communities by having them potentially targeted and stigmatized. So I think we need to be thoughtful about how we do this.
Next, we'll go to Maurice Reese from the Shoreline Journal. Go ahead, Maurice. Maurice, are you there?
Yep, sorry, forgot the mute button. Mr. Premier, you and your entire team are doing a great job keeping people informed. My concern is in looking ahead as we get closer to summer, what directions or additional guidelines might you be bringing forward to tourism operators in the rural areas, such as bed and breakfast, gift shops, antique shops, etc.?
Well, thanks very much, first of all, Maurice, for your comments about the team and Dr. Strang. We will continue to work with public health for whether or not we will require additional measures in terms of tightening down if the virus continues to spread in community. And at the same time, we will work with our small business owners across the province to look at initiatives of how we can best support them. What we're attempting to do is to look at what the national programs are doing and then finding out where are their gaps. And we as a province are trying to fill in the gaps that might be associated with whether it's small business or individuals. And we'll continue to do that. But it's our hope, quite frankly, that we will all do our part, follow the public health orders, we'll flatten the curve, and we'll slowly start to see our province open up again.
Do you have a follow-up, Maurice?
Yeah, along the same line, and I heard Dr. Strang talk about people who own cottages and the guidance that he was suggesting they follow. What about those that have a travel trailer sitting in their driveway and will want to get out. What will there be any further guidelines or limitations as to what they can do?
We've closed our parks. We'll continue to keep them closed until the public health order has been lifted, and Dr. Strang will do that in conjunction with all of us, and those private campgrounds will be in the same position. All the public health orders that are out there today will impact everyone. So we expect those Nova Scotians, whether they have a travel trailer or a cottage, to follow the orders of public health, and that is to self-isolate, no gatherings more than 5, and limit your mobility, limit leaving your property. We can't stress this enough. The more and more people continue to move around, the more and more they're spreading this virus, and harder to deal with it. And quite frankly, the longer it will be here, and the longer our economy will be shut down.
That's all the time we have for questions today. Go ahead, Premier.
Thank you, Tina. Dr. Strang has talked to you about expanding COVID-19 testing to better identify the spread within our communities. We have reached a place where we're now seeing evidence of community spread. And this shouldn't come as a surprise. Yesterday we had 29 cases, and today we had 26. Those are the highest numbers yet. On Friday, I told all of you to stay the blazes home. You've had some fun with it, and you did it from inside your home. And I've enjoyed it. Some local businesses made T-shirts and mugs and are sharing the proceeds for the sale of those items with Feed Nova Scotia and other organizations that are supporting those affected by COVID-19. And I'm grateful for that. It's okay to find the humor in these words. After all, we could all use a bit of humor now. But it's very important that people understand and heed the message behind the words. Police in Halifax have told us that they've issued dozens of tickets this weekend and handed fines to people who are not following the rules. People still walking on beaches and in parks, having garage parties, gathering in large groups. The fact that dozens of tickets were issued is astounding to me. I get that the weather's better and people want to be out, but what the reckless and selfish don't get is that they are putting everyone else at risk. They need to stop thinking about themselves and start thinking about their neighbors down the street who've been diligently isolating and following the rules. They need to start thinking about the children who don't understand why they can't go outside and play with their friends. They need to start thinking about the seniors living alone who can't see their grandchildren and who are sacrificing so much. To the reckless and selfish who think breaking the rules doesn't matter, the good doctor and I are here to tell you it does. This virus spreads and spreads fast. Just look at what's going on in Ontario and Quebec. Thousands of cases, hundreds of deaths. I feel for my fellow premiers every day. A week ago, we doubled down our testing because so many snowbirds were returning home from down south and families were coming home from March break. Now, Dr. Strang has told you we're going to broaden that testing again. And while it's a good thing that we're able to reach more people in more communities, it's a bad thing that we have to do it at all, because it means the virus is spreading into our communities. COVID-19 knows no bounds, and as I said earlier, it does not discriminate. It follows the people who don't follow the rules. So if you bought a Stay the Blazes Home t-shirt, wear it. If you bought a mug, drink out of it. And if you have a sign posted in your window or on your lawn, use it as a reminder for yourself, your family, and especially for those who aren't listening.